I am Dr. Tapas K Banerjee. I'm a consultant neurologist. I'll be speaking and replying some of the most Googled questions on multiple sclerosis. The question is, what is multiple sclerosis? Now, multiple sclerosis is defined as inflammatory demyelinating disorder of the central nervous system. This particular illness affects the people in the most productive years of their life between the age usually of 20 and 45. Now the question is, what are the early signs and symptoms of multiple sclerosis? Multiple sclerosis, usually the patient presents with acute onset blurring of vision in one or in both eyes. Another way of presenting is that the patient develops weakness of acute onset in both legs. Sometimes they have tingling sensation in one particular limb. Sometimes they may present as unsteadiness of gait, which has come very abruptly or very acutely. The question is, what causes multiple sclerosis? Now, this is a very difficult question in the sense we are not very definite about what is the exact cause of multiple sclerosis, but there is an interplay of genetic and environmental factors that can lead to the disease. There is one virus which is called Epstein-Barr virus, and people think that is a virus which, if it affects the person in their early childhood, that can sometimes be one of the causative factor in multiple sclerosis. Question is, what is an MS relapse? Now, multiple sclerosis is generally a relapsing remitting type of disease where there are acute events followed by a period of remission, and there is another acute event that happens. So, these acute events, when it happens after the first one, are called relapse in multiple sclerosis. What is a pseudo relapse in multiple sclerosis? A pseudo relapse look like an relapse of multiple sclerosis, and that can happen after exposure to sun or after the patient is in a hot climate or when they run fever. They have an event which is very similar to relapse of multiple sclerosis, but that event was a very transient phenomenon. And when you do the imaging, we don't find the relapse. It is just which happens because of the temperature difference in the environment. Question, which is a very relevant question: how is multiple sclerosis diagnosed? Now, if we see a patient who has presented an acute onset neurological deficit, the patient should undergo a certain investigations. One of the major investigation that is done is an MRI scan of brain and cervicodorsal spinal cord to see whether there are certain lesions which has occurred in the brain which are very which resembles that of a multiple sclerosis. And then we have uh, lumbar puncture and CSF analysis, which shows certain bands in the CSF, which is called oligoclonal band. We do evoke potential studies, particularly the visual evoke potentials or brainstem auditory evoke potentials. And abnormalities there also very much support the diagnosis of multiple sclerosis. Now, another very relevant question: is there a cure for multiple sclerosis? Up until today, there is no cure for multiple sclerosis. But what I can say that the previous nihilistic attitude that the people had regarding this disease, that practically there is no treatment available. Now, after 1993, there has been a revolutionary change in the sense that we have the disease modifying therapies which have come, which have been able to arrest the disease in many individuals. And if not the disease is arrested, they can slow down considerably the natural history of the disease progression. The question is multiple sclerosis a fatal disease? Generally speaking, multiple sclerosis is a debilitating disease. The patient keeps on progressing and ultimately they become bedbound. And when a bedbound patient tries to swallow, they can't swallow, gets aspiration, which means there is aspiration pneumonia and from sepsis. either from aspiration or from urinary tract infection or from pressure source. They can get a fulminant septicemia and they die out of it. Most of the patients with multiple sclerosis die from septicemia. But there are certain occasions where the multiple sclerosis, the disease itself, can be extremely fulminant, what we call Marburg variant of multiple sclerosis, where the brain rapidly gets damaged and the patient die out of brain damage within a year's time. Okay, there is a question: what is the life expectancy for someone with multiple sclerosis? Now, generally speaking, we say from the onset of the disease, people are expected to be able to live for 30, 35 years. But this is rapidly changing with the advent of very efficacious treatment. And there are now individuals who are having a normal life with normal functionality. Um, those who have a disability in the sense they are using a walking aid, we say they can live for another 6, 7 years, or maybe at the most 13, 14 years. Those who are extremely disabled, we say the life expectancy or longevity is for a couple of years only.